Hi, I'm Kim Peterson, co-founder of Light Force Therapy. I'd like to take a moment to thank you for making your purchase of Light Force Therapy equipment. We wish you many years of pain-free living as a result of using your device. Today, we'll take you through the steps necessary to most effectively use your Light Force Therapy equipment. For your convenience, this video is appropriate for all of the units in the Light Force product line. In case you're not familiar with Light Force Therapy and the technology that we use, let me give you a little bit of background information. Light Force Therapy uses light-emitting diodes, or LEDs, to produce a unique combination of frequency and wavelength of safe, low-level infrared light that helps to elevate muscle tissue temperature and increase circulation. All of these factors are essential in relieving pain and relaxing muscles, making Light Force Therapy extraordinarily effective. Now let's get started using Light Force Therapy. The first step is to plug the adapter into the unit itself, then plug the cord into any standard power outlet. If you have a pocket dock, you will want to plug the unit in to charge the battery for 6 to 8 hours. The second step is to perform Light Force Therapy's patented EPS routine. Place the device directly on each ear, palm, and sole for 1 minute each. This will help you relax and begin using Light Force Therapy. While it is helpful and enjoyable, the EPS routine does not have to be performed before each treatment. All units have an EPS setting, so you don't have to worry about which frequency setting to put your unit on. Next, refer to your Quick Start guide to determine which frequency setting is right for you. For tension reduction, general relaxation, or to improve local circulation, depending on your unit, turn the setting to low, low 1, or low 2, and place directly on your problem area for about 10 minutes. For a dull ache or consistent and steady pain, set the device to medium and apply directly to the area of concern for 15 to 20 minutes. You will notice the pocket dock does not have a medium setting. We recommend using high. For a continuous, intense pain, set the device to high and apply directly to the skin for 10 to 20 minutes. The LFT 9000 and Supernova both have sweep or full cycle settings, which are ideal if you're not sure which setting to use. These cycle through all of the settings from lowest to highest. It takes the guesswork out of finding the right setting for you. All of our Quick Start guides give only suggestions as to how to treat your particular pain. We recommend using the device for 10 to 20 minutes, 1 to 5 times daily. However, you are unique in your condition, and we encourage you to experiment with different settings to find which is best for you. Now let's review how to use any accessories you may have purchased with your device. All of our devices can be used with a strap kit. This allows you to perform hands-free treatments easily and conveniently. If you have an LFT 9000 and want to attach the strap, simply loop the elastic strap through the 2 openings on the top of the unit, Velcro side up, and secure the Velcro of the strap to the appropriate snugness. The Supernova comes with a removable handle attached. To remove the handle, press down on the small plastic flap behind the handle and pull the handle back. If you want to attach the strap, line up the grooves of the strap kit attachment with the slats on top of the unit. Gently push down as you insert the attachment into its proper place. The strap then feeds through the top of the attachment, Velcro side up, and can be used to secure the unit to the body. To reattach the handle on your Supernova, line up the grooves of the handle to the slats on top of the unit. Gently push down on the handle as you guide it into the slats on top of the device. To use the strap kit on the pocket dock, simply slide the unit into the case, thread the strap through the loop on back, Velcro side up, and secure in place. Let's go over a few frequently asked questions. Please remember that you can find all of our frequently asked questions in the product usage guide. Why do the lights pulsate on the low setting and not on any of the other settings? The lights pulsate on every setting. However, they pulsate so quickly on the medium and high settings that they appear as a steady stream of light. The low setting is the only setting on which the lights pulse slowly enough to be noticed by the human eye. So how can I be sure that the infrared diodes are functioning if they are invisible to the human eye? Each infrared diode is connected to a nearby visible diode, either red or green. If one of the infrared diodes malfunctions, the adjacent colored diode will not light up. I have used my unit for 2 days. Why am I still hurting? Keep in mind that these units serve as a therapy for pain. They are not a miracle drug or a painkiller. Most people find that if they use the product several times a day consistently, they will eventually use the unit less and less over time. Remember that you may need to use the light longer to feel relief from long-standing conditions such as arthritis than for a more recent condition such as a sprain or other abrasion. Well, now that you know how to properly use your light force therapy device, and we've answered some of our most frequently asked questions, you are ready to begin relieving your pain in a convenient, safe, and effective way. Thank you again for your purchase.
American Medical Review is a national platform where science and art meet, where improving and preserving health and wellness take center stage, where the spotlight seeks out and shines on the healers and innovators. These editorial profiles, presented on public television, single out advancements in medical treatments, procedures, and services.
Light Force Therapy was handpicked as a featured guest because of its commitment to promoting progress in the field of health and medicine.
Hello, I'm Morley Safer. We Americans tend to take our health for granted until we lose it. Today we focus on a medical advance that helps us take better care of ourselves.
Just about anyone who has experienced chronic pain can tell you about its debilitating effects. The constant or recurring aches and pains can take a heavy toll, both physically and emotionally.
Well, I was having shooting pains down my legs and around the side of my hips, and 3 nerves were involved, and I saw a neurologist who told me that perhaps surgery would help, and if it got too bad, to come back to him and he would give me morphine. And I thought, this is awful. I'm in so much pain now, and my life is just going to be this, and then I'm going to get older and still be in so much pain, and I was very depressed, very.
The side effects of many of even the most prescribed pain medications can be quite varied and sometimes unpredictable, depending on the patient's individual profile.
People that suffer from chronic pain are in a very desperate way today. Unfortunately, medicine doesn't have much to offer other than products that mask their symptoms. They mask the pain, the inflammation. The problem is people are taking these products over time because they are not curing the condition. They need to take more and more and more. This could lead to problems such as ulcers in the stomach, liver, or kidney damage.
There are very few prescription pain medications that don't pose some sort of risk. Even homeopathic treatments can often have contraindications. It's one of the primary reasons many are looking for alternate solutions.
When coping with pain management, there's many other modalities of medicine or therapies that individuals can look at to deal with pain. One of them is biofeedback. Biofeedback is an excellent therapy, but unfortunately it requires people to follow instructions on a daily basis when they're feeling the stress to stop and focus on their training and biofeedback. There's a new technology out that utilizes a new therapy called light therapy, utilizing LEDs, that can incorporate the same type of benefit without that risk of human element. The technology does it for us.
A new generation of LEDs, or light-emitting diodes, is capable of producing specific wavelengths of energy. This, combined with the appropriate frequency, produces photons that stimulate the cells of damaged tissues.
Individuals vary in their cellular composition, and it's important that a specific profile of wavelength and frequency is offered when you're dealing with an acute injury or a chronic ailment. What these wavelengths do is offers the cell an opportunity to rebalance by stimulating the photoreceptors within the cell.
I wasn't reacting very fast to the lights, and I wasn't using them consistently because of that. Then I started using them consistently, and then using it now about once every couple of weeks. I find that the pain is gone, and it hasn't even returned. I'm just amazed.
All medical devices come under scrutiny by the Food and Drug Administration. The application of infrared light therapy was no different.
Certainly there are forms of therapies that offer negative radiation that affect the cell very aggressively. This technology does not comprise any of those negative frequencies or wavelengths.
Up to now, the trend in medicine has been focusing on biochemistry, the chemical reactions within the body, and how medications can alter the different symptoms that we get from disease. Light therapy is offering us a whole new area of science, and that light therapy might be the actual precursor to all biochemical reactions within the body.
For centuries, we've known that radiant waves provide remarkable power. Today, the use of light energy in modern science is raising hope for more illuminated healthcare options.
Every day there are developments that can help improve the quality of our lives. As these breakthroughs occur, American Medical Review will bring them to you. Thanks for joining us.
Light Force Therapy manufactures an LED device that has been researched over a number of years in clinical settings, helping to address chronic issues, and is now available in a form that is very cost-effective and available, most importantly, for in-home use for people who are suffering from chronic as well as acute problems. Everything from stiff and sore muscles to the arthritis that really prohibits your ability to have the quality of life that you so desire.
The effect was, after the third treatment, I had no more pain, and that had been after 2 weeks of very acute pain where I didn't even want to move.
Light Force Therapy and the technology itself is basically in its infancy. There is so much yet to be unveiled and discovered and reported in terms of the benefits that this will offer a number of different market segments. We are passionate about the potential for this technology. We are committed to being the innovators and the leaders within this industry. Our aim is to make Light Force Therapy a household name within the next 3 to 5 years.
Wherever the art of medicine is loved, there also is love of humanity. Once again, American Medical Review extends a special thanks to the companies and organizations that have risen to meet today's health and wellness challenges.